So I want to take just a few moments to talk a little bit about 2020 Mom and the work that we're doing. That's Lisa Kay. You may have seen her walking around earlier, and she had a little bit of a emergency pop-up. So I'm going to be talking here by myself, and if anyone wants to come up and join me, feel free. Liz, I know you've had some comfort in doing some of this work in the past. So, well, let me just go back here. We're going to talk a little bit about where we've been as an organization and where we're headed, and we've got some really exciting things that we want to share with all of you. And so one of the first things that we were able to do, and Rahil, Dr. Briggs, I think you're going to cringe when you hear some of this, but one of the first things that we were really able to do by convening all of you over and over again, talking with individual providers, talking with moms about their experiences, is really understand what's happening? Why aren't women being diagnosed and treated? And we came to realize that we can't continue to rely on doctors alone, that it's not that simple. And we heard earlier that referral pathways and embedding treatment within that OB or pediatric setting is ideal. We also declared really that there's a shortage of maternal mental health professionals. And we've talked a little bit about that earlier today as well. In particular, there's a shortage of psychiatrists. And those of you that treat moms know that's the case. We've got someone on our board who's looking to open outpatient day treatment program at her hospital and is having a hard time finding a psychiatrist that's qualified. And so it's a true challenge for us in this space. We'll talk a little bit about what we've done to address that shortage in just a moment. We also came to think about what are the other common denominators in a woman's life during this time, right? If we can't rely on doctors alone, what can we rely on? And so we point out the fact that 99% of women deliver in hospitals. And so is there something there? Should we be thinking about hospitals here? And that 86% of women now after the ACA have insurance. So that's a pretty good size of the population. Is there something we should be doing and partnering with insurers on? And so I'm going to ask Kelly, who has left, I see, to tee up our video. I don't think I can do this by myself. We'll come back to that video. Oh, thank you, Michelle. And while Michelle's pulling that up, I'll talk a little bit about that second bullet point. Actually, can just go right back. The second bullet point talked a little bit about, again, recognizing the shortage of maternal mental health providers. And what we did to help address that shortage was that there was a shortage of training. We have great organizations like the LA County Perinatal Mental Health Task Force that has an amazing training program here in Los Angeles, but most counties and most states have nothing, no training. Postpartum Support International, one of our partners, has a great 2-day training program, but requires significant upfront investment and travel for a lot of people to get to that training program. So let me go back. So we ended up launching a web-based training certificate program with our partners at Postpartum Support International to bring certificate-based training to everyone in the United States who's interested in a 7-class course. We've been doing 2 courses a year, and we can't keep up with the demand. This Monday, actually, we started our 5th class, and we had to turn away 50 people, and we have about 150 enrolled in the course. So it's quite exciting. People are craving this training and want to do something to help moms, and so it's exciting. Thank you.
Did you know that mothers give birth to 4 million babies in the U.S. every year? Let's face it, it is a joy, but also a challenge to enter motherhood. There are a lot of diapers to change, feedings, crying, sleepless nights, learning to care for a new baby, dealing with hormonal changes, and more. And new moms are expected to rest and recover with all of this. It can leave any new mom feeling overjoyed, but exhausted, overwhelmed, irritable, and anxious. During this transition, 80% of moms will experience the baby blues, which can include tearfulness and sadness, inability to sleep, changes in appetite, and self-doubt about being a good mother. The blues generally last a couple of weeks. But up to 20% will go on to experience something more serious, like postpartum anxiety or depression. These conditions are the most common complications of pregnancy. The problem is that most of these moms will never get the help they need. Here is why. First, most expecting and new parents are never told about maternal mental health disorders. Second, there is a shortage of mental health doctors and therapists, and not all receive training in maternal mental health, and those who are qualified to treat are not easy to find. Third, most OBGYNs and pediatricians do not screen moms for maternal depression or anxiety because of a number of obstacles, like lack of time and not knowing where to send moms for help. All of this makes it a broken system, and as a result, hundreds of thousands of moms and families suffer in the U.S. every year. But we can solve this. First, let's recognize doctors alone cannot solve this problem. Since most moms deliver in hospitals, and millions more will have health insurance because of the Affordable Care Act. The 2020 Mom Project sets forth an alternative path to change by focusing on what hospitals and health insurers can do to help. For example, what if hospitals informed women and their families during childbirth classes about symptoms of maternal mental health disorders, whether they are at greater risk, and common triggers such as sleep deprivation? What if health insurers identified maternal mental health specialists in their directories and helped moms find treatments? What if OBGYNs hung posters in their office listing the symptoms with an 800 number to call for help? These are just a few of the changes the 2020 Mom Project recommends. We believe that together, these simple steps can lead to a big change by the year 2020. Learn more and join the movement at 2020momproject.com.
Great, thank you. Everyone loves that video. All right, so let me just go over a couple of things. So you learned about the 2020 Mom Project. It's really the framework that we launched several years ago to try to provide this sustainable pathway for change. Cigna, our sponsor for today's event, has adopted the insurer recommendations. And anyone that's interested in learning what that means, you heard one example in the video of including a maternal mental health designation after providers' names in an insurance provider directory for those that are trained in maternal mental health and have a certain number of practice hours. That's one example. We also have recommendations, which we'll talk a little bit more about, and you heard in the video, for hospitals. And we've had 2 hospital systems adopt, and we have also learned, I don't remember who it was earlier, it's really difficult to go knocking on individual hospital administrator doors and talk about this program, particularly when they're baby-friendly movement and a lot of other things going on. So we're going to be changing up our strategy around working with hospitals. And then this breakthrough is a online behavioral health network that provides treatment online, so women can do a counseling session over their laptop with the same provider over and over and over again. They've adopted the network recommendations and identify those that are trained with that MMH designation after their name. So again, the project right now we've addressed in hospitals, insurers. We also have recommendations for doctors like OBGYNs and pediatricians, and we kept them simple to start. We don't say screen because we know that that doesn't work. We say instead hang posters in your exam rooms that have the 800 number to Postpartum Support International's warm line. We say have one staff member in your office trained in maternal mental health and provide free training resources there. And we also say learn the landscape in your community. Who's treating maternal mental health disorders? Find the therapist, find the psychiatrist, find the hospitals that have programs, if any, so you're in a position to refer moms, even if you're not screening. So we're also looking to expand some of our work this year, and we're excited about the development of a community coalition toolkit, taking what organizations like the Butte County Coalition that some of you heard about earlier, the task force, the LA County Perinatal Mental Health Task Force, and others have learned to create a toolkit to allow us to help other communities do this work. Those of you in public health in particular, working with the Medicaid or even uninsured population know that there's, no county looks alike. There's different departments doing different things. And so we really want to be able to support county work. And California in particular, we've been working with the California Department of Public Health, which we'll give a wave to because they're probably cheering and saying hi now, and we've got some in the back. And really been excited about the movement and interest at the county level here in California, and are excited to be able to support the counties with this toolkit coming soon. We've also heard a lot about sustainability and how do we create sustainable treatment programs right now. Most of the programs that are available in communities are grant-based. So what do you do when the grant runs dry? And we're very much interested in how insurers can reimburse. How do we bill? What are the billing best practices and reimbursement rates that we want to promote and start to think about? So Dr. Briggs, we definitely want to talk with you. In California, we've actually done a survey of insurers, and we're having some Columbia University students help to process what we found there, and it'll be fascinating, I think, to come out with that white paper. And then another thing that we're looking to do this year, and it's really ready to go, thanks to the help of Dr. Diana Lynn Barnes, who's a forensic expert in maternal mental health. And we, as she shared earlier, we often find tragedy around psychosis, and that women may have harmed their babies or their children. And tragically, we see that they're falling through the cracks twice, right? The system fails them twice because they first don't get the treatment that they need, and then second, often are really put in a difficult situation in these legal trials. So what Diana Barnes has helped us do is identify cases that other attorneys can start to look at and study, and that will be a website that's up, or a web page that's up on our website very soon. So we're excited about that. All right, so what's in a name? You guys heard me say that we are no longer actually California Maternal Mental Health Collaborative in California. Our name change was approved here not too long ago, but still with the IRS, we are California Maternal Mental Health Collaborative. That filing was just done, and we hope to unveil and be officially 2020 Mom here in the next couple of months. So we wanted to give all of you a heads up about that. And you might say, but why? You're doing great work in California. Are you going away? No, we're always going to call Los Angeles our home base, California our home base, and a place of experimentation. But because of the programs that we've developed and the interest in other states and cities, we really felt like the name change was appropriate. And quite honestly, most people have been calling us 2020 Mom anyway. One other change this year is because our 501c3 was approved, that IRS tax deductible status, just over a year ago. We began to build out our board of directors, who I had stand up earlier, and we have 13 wonderful board of directors. We also are still all volunteer staff, and we have contractors that we hire to help us with some of our work. So we talked a little bit about the hospital program and what the recommendations are. We heard a little bit in the video, but just to give you some examples, again, is to promote awareness, again, modifying birth class curriculum. And again, I have to give a shout out to Dr. Diana Lynn Barnes, who's actually helped us develop through an adaptation of one of her own books, curriculum for hospitals to start using. We'll have that available soon as well. And then we also ask hospitals to provide information at discharge, and then promote and protect sleep. And this really boils down to policies, this has been a bit controversial because of the baby-friendly movement, but we've got some hospitals that have done some really remarkable things around promoting and protecting sleep, since we know it's a key trigger. If mom's not sleeping well, that she's at higher risk. And then we ask hospital staff that interact with moms to train their staff in maternal mental health. And there's a specific web-based training program that we've launched to allow hospitals to do custom web-based training for their staff and then be able to keep it and show new staff in the future. We're doing a big training program with a hospital called Lehigh Valley in Pennsylvania. That's a really large hospital system, which is exciting. So where we're going now, and we wanted to show that hospitals get to tout that that they've accomplished this accreditation status, if you will, if they accomplish those things. But we're also now looking at changing our process to start to survey a community and survey a group of hospitals. This just talks a little bit about what we're doing, but let me just explain it briefly. And as I mentioned earlier, because it's hard to knock on hospitals' doors and go door to door and say, this is something you can do to help your moms and help your community. Instead, we've come up with this concept where a community can be surveyed at once. And there's a list of 12 best practices for hospitals to do, not just those 4, but 12 best practices, including whether they have an outpatient day treatment program. We want to give hospitals credit if they're doing something like that, including an inpatient mother-baby unit, which some hospitals do have. So how do we give them credit and recognition for the work that they are doing, and also to help raise awareness and give ideas to hospitals that haven't yet tackled any of these things? So the idea is that a community would be surveyed at once. So all the birth hospitals in one community. So in Los Angeles, I think, Liz, we found that there are, 30, 40 birth hospitals in the county, something like that, would be surveyed at once. They would receive their survey results and their scores racked and stacked against all the other hospitals so they can see where they come out and how competitive they are in this space. And then technical assistance would be provided through the form of webinars and Q&A calls, et cetera. And then 6 months to a year later, the hospitals would be resurveyed and the results would actually be published. So we're excited about this change in concept. We've got some interviews and meetings with research institutions that might be interested in helping to partner with us on this. I already talked a little bit about the goals. We're looking for a national research partner, preferably on the East Coast since it's a national project, and then securing some funding for the survey work. And the communities that have expressed interest so far in doing a pilot or even a survey after the initial pilots are these communities here. And then we're also looking to identify local organizational partners, some who might also be interested in providing technical assistance, like the LA County Perinatal Mental Health Task Force in Los Angeles. So one last topic that I want to share with you is those of you that followed our work last year may have heard about the Assembly Concurrent Resolution 148 this year, which is the status on, the task force or the commission on the status of maternal mental health care. And you may have heard about blue ribbon commissions, like a blue ribbon commission on autism. They're temporary groups of multi-stakeholders that come together to study what's happening on a certain subject. And so we were lucky that there was no trouble getting that resolution passed here in California last year. And thank you to many of you in the room for providing letters of support. And now you can see this very first bullet. We are very excited to say that the resolution itself is not the force of law, so there was no state funding that came with it. But we have just last week been informed by the California Endowment that they will be funding this task force on the status of maternal mental health care. And again, I pointed out earlier that our research partners for this task force are the Central Valley Health Policy Institute. Can you guys give a wave again here in the room? So we're very, very excited about this work. And it's a pretty sizable grant that has been awarded to CSU and will be a subcontractor supporting the work, $100,000 grant. We were hoping that and the endowment would come down with a big check to give us, but that didn't work out. The goal is to launch this commission in May. There will be up to 18 members on the commission who will, again, study the state of maternal mental health care in California, but also learn about great things that are happening in other states. Massachusetts, as Dr. Briggs has mentioned, is doing some remarkable things, not only on payment reform, but in maternal mental health. And that's a state we want to look at. There's also some great work that has come out of New Jersey, great research, I should say, that shows just mandating screening and reimbursing even for screening doesn't lead to improved outcomes. There's more to the story. So we'll be looking at all of those things. And the goal is to have a white paper of recommendations white paper of findings and recommendations issued later this year, likely early next year. So really exciting work there. And the last thing, so I'm like Neil, there's just one more slide, is that in late 2013, we had a stakeholders meeting in Washington, D.C. to bring leaders together from ACOG, the American College of Obstetrics and Gynecology, and others to talk about maternal mental health. And from that group, we decided that we should continue to meet and formed this new national coalition for maternal mental health that met regularly last year and is continuing to meet and become a more formal organization this year. The founding members or the founding nonprofits are the National Healthy Mothers, Healthy Babies Coalition, which some of you know, Postpartum Support International, an organization called Mother Woman that does great training and support group training that we'll be bringing to California, by the way, late this year or early next year. Postpartum Progress, which is award-winning blog in maternal mental health and also a nonprofit. And then there's also state and local nonprofits that sit on the national coalition. The goal of the coalition is to work on what I call C initiatives. So we're interested in sharing with each other, bringing everyone together to talk about what they're working on, engaging outside stakeholders. The National March of Dimes chapter is coming to our next meeting. We also, National March of Dimes office. We also have had the National Institutes of Mental Health. We've had AMCHIP, which don't ask me what that stands for, the Association of Maternal Child Health Professionals, come. So it's really about hearing what they think about maternal mental health. Is it on their radar? How can we help you promote maternal mental health within your programs? And then, of course, advocate for change and raise awareness. You heard about the May campaign, a social media campaign that the National Coalition launched. We wanted all the nonprofits in this space to be able to be behind one uniform social media campaign. That's an example of, what are they called, memes or something, you guys, the images? I'm not like a big on the marketing terms, but these images that were shared for 1 week during May, the campaign's being developed as we speak for this May. So be on the lookout for that. Again, the Twitter handle and the Facebook page is May Campaign. We also, through the National Coalition, are encouraging advocates like all of you to form walking teams. We have t-shirts that can be ordered through Vistaprint, really inexpensive rate, blue dot balloons and things. So if you're interested in getting out and getting some vitamin D with your friends and having social support and pushing strollers with moms of newborns, we would love to see more of those walking groups pop up across the country. And then finally, we've developed some new posters, and actually back a slide. Well, it was there. We this year are also going to be engaging moms and inviting moms to go out into their communities during this week in May and hang posters. So go to your primary care doctor, your OBGYN and pediatrician and hang posters. And we're really excited about that. They're developing like selfie picture contests and such to have moms post their photos of them hanging the poster in their pediatrician's office, that kind of thing. So it's going to be a fun campaign, I think, and really we hope to see some great grassroots movement and people like you hanging posters throughout your communities. The last thing I want to mention, the last slide, is that we are hosting our very first sort of signature fundraiser this year, and we're quite excited to announce that it will be a farm-to-table brunch in Valencia, California, which sounds like it's a world away for those of you that are here in Los Angeles, but it's actually quite close, just 25 or so miles from here, north on the 5. It will be at the Valencia Country Club on May 17th, and we just found out yesterday that Whole Foods will be a sponsor, so we're really excited. And I think I have one last slide. Neil, I'm being a Neil. Last thing is, we just want to thank you for all of your support and coming. It means a lot to us to have you here. And if you haven't signed up for our e-newsletter yet, you can do that on our website, 2020mom.org. We also have membership, so if you're interested in supporting our work in a bigger way, we would love to have you join as an inner circle member. They're very low membership rates a year, and we've had gatherings and we've had phone calls where we get to ask you, what do you think about the programs we're developing? What should we be thinking about as we move forward? So please consider that if anything that we've shared today is exciting you. And then, of course, we're on social media. We also want to hear your ideas at any time. Thank you, people, for Think Tank ideas. That's great. You can share those through email or today on the Think Tank line. And then just a reminder again that as a result of this event, there is now a new ACEs Connect maternal mental health group. If you go to acesconnection.com, we'll also send the direct link out to everyone through our e-newsletter next week. And then I'm going to close with one last video. Hope to see all of you next year.